Welcome to PDRO 7200 Fundamentals of Drug Information. The objectives of this course are to provide an accurate and succinct verbal or written information that is appropriate for the target audience, such as the patient, caregiver, or other healthcare professional, to demonstrate proficiency in the use of computer-based medical information databases, to construct and execute a systematic search using primary, secondary, and tertiary biomedical literature, to state the merits of primary, secondary, and tertiary biomedical literature, and to explain the results of a biomedical literature search to healthcare professionals and the lay public. This course is divided into 4 lessons. In Lesson 1, I will teach you the overview of drug information sources, primary, secondary, and tertiary literature. In Lesson 2, we will review the systematic approach to answering drug information questions and more about tertiary resources. And in Lesson 3, we will talk about primary and secondary resources. And finally, in Lesson 4, we will talk about useful internet sites. There are 3 types of assessments in this course. The first type is for you to answer drug information questions. And in answering these drug information questions, you will need to use library resources. I will return a question if you do not cite library resources. You also need to write the answer in the correct language for the requester. Secondly, you will participate in weekly discussion forums. And lastly, at the end of the class, you will have an exam. This exam will be in 2 parts. Part 1 will be a searching exam, which will consist of 10 multiple choice questions. And what I mean by searching is that you will be given a multiple choice question and you will look in the databases for the answer. Part 2 is going to be a secured 40 question multiple choice exam, and this will cover the class notes or these lessons that I will provide you. If you ever need to get a hold of me, you may email me at michaeline.goldwire@ucdenver.edu, and then my mobile cell number is there. Please leave a message. I'll probably have to call you back. And I do pronounce my name Mikey, so it's Dr. Mikey Goldwire. Welcome to our first lesson, Overview of Drug Information Sources, Primary, Secondary, and Tertiary Literature. The objectives of this lesson are to describe the practice of drug information, describe the hierarchy of medical literature, describe the Denison Medical Library site and resources available, and to describe information available in the drug information databases. The provision of drug information is a great responsibility. Guessing the answer or assuming the answer can place a patient at substantial risk. Providing the wrong information can potentially harm the patient. Pharmacists need to provide the answer accurately and in a timely fashion. Knowing how to answer drug information questions and what resources to use are important skills for all pharmacists, regardless of practice site. In all pharmacy settings, pharmacists are recognized as drug experts and are seen as providers of drug information. It is imperative that pharmacists know how to provide accurate and complete responses to drug information requests. One of the most important skills you will learn in this class is how to find information. A wide variety of resources are available, and it's important to be familiar with the content and unique features of each resource. Information available to answer drug information questions is vast. To help you navigate, each drug information question is answered in a systematic way that maximizes your time and efficiency. You will also need to gather the appropriate background information to formulate the ultimate question to be answered. Because you are the drug expert, you will have to ask the requester specific questions in order to determine the real question that needs to be answered. This is also called the ultimate question. Once you know the ultimate question and have searched the literature, you will need to evaluate the literature critically for validity and applicability. In devising your response, you must develop, organize, and summarize the information you found, and be able to communicate clearly, whether the answer is communicated verbally or in writing, with consideration given to the requester's potential for understanding. Finally, you must be able to anticipate other information the inquirer may need. All of these skills will help foster critical thinking. As I just mentioned, you need to know your resources in order to answer drug information questions efficiently. I would like you to become familiar with the resources available to you at the Denison Memorial Library. So please know what is available to you through the library site and bookmark the library site. And I have the URL there on this slide for you. There are 3 different categories of drug information resources: primary literature, secondary literature, and tertiary literature. Primary literature consists of original research, which may be a study or a case report, and is published in biomedical journals. It is the most up-to-date of all literature types and takes the most time to comprehend. Primary literature is often not needed for answering routine questions. Secondary literature assists the user in locating primary literatures. Examples include Medline, which is available through PubMed or Ovid, or also review articles. Tertiary literature includes textbooks, online databases, and other resources such as a review article in which primary literature findings are summarized and presented in an easier to read format. Tertiary literature has a great lag time compared to primary literature due to the publication constraints, but is much easier to use. Each category of resource provides a unique and different aspect to answering a drug information request. A user must know the strengths and limitations of each and how to effectively use each to answer drug information questions efficiently. Primary literature consists of published or unpublished works of original research and new discoveries that introduce new knowledge or enhance existing knowledge. These articles are published in biomedical journals, such as the Journal of the American Medical Association, JAMA, the New England Journal of Medicine, American Journal of Health System Pharmacy, and the Annals of Pharmacotherapy. However, journals contain more than just primary literature. Review articles, editorials, policy statements, and clinical practice guidelines are examples of published journal articles that are not considered primary literature. Some primary literature considerations include: is the journal peer-reviewed? The peer review process uses experts in the medical specialty to review article submissions. These experts provide comments to the author, who then makes changes and resubmits the article. Unfortunately, the intent of this process is sometimes abused. Experts may be biased to either their content or author. This process also tends to keep marginal papers from being published. In addition, if expert reviewers are not versed in statistical methods, paper with faulty statistics may be published. Also, if the reviewers fail to take time and carefully review the paper, errors may be published. Some authors may abuse this publication process. They may divide one research project into separate publications rather than a single unifying publication. They may also publish the same research in more than one journal or literature search. Some may also publish fraudulent findings. Another thing to keep in mind is the journal reputation and impact factor. The impact factor seeks to measure the influence of a journal has on its field, measures how often scholars and researchers have cited the articles in a particular journal in the most recent 2 years. Simply put, the higher the number, the better the journal's impact factor. The better the journal's impact factor, the more influence it is supposed to have in its field. Thirdly, the source of funding. Keep in mind with many of the open source journals, which are journals in which the reader does not have to pay to read the article, may require the author to pay a fee in order to get their article published. In some cases, this may be considered a source of bias because, again, the author is paying to have their article published. Once you locate the primary literature, you are going to need to dig deeper. You're going to need to review the study methodology, the clinical relevance of the article and its results, and the patient populations that were studied. The primary literature is the most current type of literature and is the foundation upon which other types of literature are based. There's a tremendous range of information in the primary literature, and it personally assesses utility and validity. However, there are disadvantages, and these include difficulty obtaining the full text article. The information is limited to the individual study described, and skills are required to interpret the study correctly. In addition, there is an overwhelming amount of articles published in the primary literature. Here is an example of a primary literature article that I just participated in with a journal club. This is from JAMA Internal Medicine, and it is titled Stroke, Bleeding, and Mortality Risk in Elderly Medicare Beneficiaries Treated with Dabigatran or Rivaroxaban for Non-Valvular Atrial Fibrillation. A primary literature article consists of an abstract, a background, methods, results, conclusion, and discussion section. I would like to specifically mention the abstract. The abstract is a summary of the article and is often divided into 4 parts: the background, methods, results, and conclusion. It is not appropriate to use an abstract as a resource when answering a drug information question. You will need to pull the original article and assess the article. Again, it is not appropriate to use the abstract to answer a drug information question. Secondary literature consists of an abstract and bibliographic or indexing services designed to help retrieve primary literature. Examples include the Iowa Drug Information System, International Pharmaceutical Abstracts, Medline, LexisNexis, and the Cochrane databases. These resources provide quick access to the primary literature. These databases provide you a citation for the article. Some, like Medline, provide a summary of the article as an abstract. Advantages of the secondary literature include that you can construct searches to find specific information, and current citation information is available. Disadvantages to the secondary literature include the lag time, limited scope of coverage, what journals are covered in that secondary source, and the training to use effectively. You must be able to retrieve references, and you have to filter through your list of potential articles. You must also track down these resources before looking into your answers. And that's why it takes time to use the primary literature when answering a drug information source. You first go through the secondary literature in performing a high quality search. We will be going over this in Lesson 3. Some examples of secondary resources are Medline or PubMed, Cochrane Database, Google Scholar, ClinAlert, Embase, International Pharmaceutical Abstracts, Iowa Drug Information System, LexisNexis, and Ovid. The content of the secondary sources varies depending on the source, and each has its own specific inclusion criteria. For example, you can have medical content, which we do find in Medline and Embase, and also in Ovid. We have evidence-based literature in Cochrane Database. We have nursing literature in CINAHL, and pharmacy literature in IDA, which this CU does not have access to. And then keep in mind, please, that all medical journals are indexed in Medline. Tertiary literature are resources in which the editors or authors collate and interpret primary literature from multiple sources and provide a summary of this information into a more concise and usable format. One type of tertiary literature is a drug compendium. A drug compendium is a general text available as a book or online that contains general information about drugs. Examples include the physician's desk reference, facts and comparisons, lexicon, AHFS drug information. General textbooks are also tertiary literature, and they're available as a hard copy or electronic. Examples include pharmacotherapy, Goodman and Gilman, and the Drug Information Handbook. Review articles, online databases, and DI software developed for personal digital assistants, PDAs, or smartphones are considered tertiary literature. Tertiary literature includes reviews of literature by experts on the topic. These resources are easy and convenient to use when answering drug information requests and usually contain references or citations to the primary literature. The major disadvantage is the long lag time compared to primary literature and possibility of bias and incomplete information. Tertiary references often serve as a starting point to identify information because they provide a complete overview of information on a specific topic. These references are convenient, easy to use, and familiar to most pharmacists. Because these resources contain summary information, tertiary resources are preferred as a first resource to use when answering a drug information question. One limitation to tertiary resources is lag time due to publication. Because medical information is constantly changing, tertiary references may become outdated by the time they are published. Although the tertiary resource may be available online, such as facts and comparison, updating content may take time depending on the policy of the editor. In general, online tertiary resources are updated in a more timely fashion than hard copy counterparts. Tertiary resources may be incomplete due to page limitations, whether available in hard copy or electronic. Other limitations may include human bias, incorrect information, or lack of author expertise. Therefore, it is important to critically evaluate tertiary resources. The online drug databases available to you through the Denison Memorial Library include AHFS Drug Information, Facts and Comparisons, LexiComp, and Micromedics. Other tertiary resources available to you through the library are books, print books or ebooks. Some of the ebooks and the databases in which you can find them are in Clinical Key, Access Pharmacy, Access Anesthesiology, Pharmacy Library, StatRef, and ebook search on the House Science Library site. Other tertiary resources that I would like you to use when answering your drug information questions include UpToDate, Dynamed, Pharmacist Letter, Natural Medicines Comprehension Database, Clinical Key for Nursing, Isabel Diagnosis, FDA.gov, CDC.gov, professional organizations, and package inserts. When answering your drug information questions for this class, I need you to use those resources available to you at the library. Again, the drug databases available to you are AHFS via StatRef or LexiComp, Facts and Comparisons, LexiComp Micromedics, and also disease state databases that provide evidence-based medicine are UpToDate and Dynamed. One more time, you need to use the School of Pharmacy resources to answer all your drug information questions in this course. Do not use Hippocrates, Wikipedia, or Google. You may use AHFS, Facts and Comparisons, LexiComp, Micromedics, UpToDate, Dynamed, Clinical Key, and Medline, and other databases that you find on the library site. Drug databases are organized in monographs. Monograph is a systematic description of a specific drug properties that may include description, classification, mechanism of action, pharmacokinetics, administration, indications, dosage, interactions, contraindications, precautions, adverse reactions, how supplied, monitoring parameters, patient information, and IV compatibility. Micromedics is a very large online database. It has several components, including drug information, poison information, and patient education. Information is full text, evaluative, and updated quarterly. Micromedics is a very large database that houses several databases that are specific to certain areas of pharmacy. As you can see, the components of Micromedics include drug dex, drug interactions, poison dex, Identidex, disease dex, AltMed dex, Trissels 2, Martindale's, Care Notes, Repo Risk, Shepherd's, Lab Advisor, Red Book, Index Nominum, MSDS, and Neofax and Pediatrics Drug Information. Here is the home page of Micromedics, which you will access through the library homepage near the bottom under Pharmacy Resources. As you can see, the top menu includes Home, Drug Interactions, IV Compatibility, Drug ID, Drug Comparison, Care Notes, which is the patient information leaflets, Neofax, Pediatrics, and other tools, which includes Redbook, Toxin Drug Product Lookup, and calculators. You can search in the main bar by all, the drug, the disease, or toxicology. Near the middle, you see three separate links that include latest news, support and training, and resources. Under Resources, you will find specific information regarding black box warnings, comparative tables. Do not confuse drug lists, drug classes, drug consults, and REMS. Drug Dex is a general tertiary resource designed to answer questions regarding drug and patient-related questions. Drug Point Summary provides summary drug information and was formerly known as USPDI Volume 1. The Drug Points provide summary information on dosing, drug interactions, adverse events, pregnancy warnings, indications, cautions, therapeutic classes, brand information. Drug Dex provides evidence-based detailed drug information that is gathered from primary literature and summarized by editorial specialists. The database of drug information is presented in a standardized outline format using monographs. Summarized and referenced data from the primary literature are included on dosage, pharmacokinetics, adverse reactions, drug interactions, clinical applications and uses, comparative efficacy, contraindications, precautions, teratogenicity, effects in pregnancy, intravenous admixtures, therapeutic indications, and patient instruction. Drug Dex also includes information on both FDA-approved and investigational drugs, as well as non-FDA-approved uses, OTC information, and other pertinent drug information. I particularly like the Place and Therapy section under Drug Dex. The default monograph when searching for drugs in micromedics is the Quick Answers. In this section, you will get abbreviated information about the drug. In order to get in-depth information about the drug for which you are searching, you need to choose the in-depth answers. When I go to micromedics to look up drug information, I always look in the in-depth answers section of the drug monograph.
You have received an order from the attending physician for sumatriptan 10 mg nasal spray to treat a patient's acute migraine. Using Micromedex Solutions, you are able to verify the dose is acceptable and no dose adjustments are necessary. This medication is in addition to the patient's other current medications, which are trazodone and amlodipine. Checking the interactions you see that there is a high probability of increased risk of serotonin syndrome. Clicking the sumatriptan trazodone hydrochloride link for more information, you review the clinical management section and add the monitoring note to the patient's medication administration record. Then an order comes in for a patient being treated for aspirin-induced asthma. The order is for montelukast sodium. You're not familiar with this drug being used in conjunction with this condition. Aspirin-induced asthma is not labeled in FDA-labeled indications, so you check non-FDA labeled indications, where aspirin-induced asthma is listed. Clicking on the Strength of Recommendation and Strength of Evidence links, you don't feel confident that the patient has been prescribed the most effective drug therapy. Searching for drugs that treat aspirin-induced asthma clearly shows, however, that montelukast sodium is the only medication indicated for this condition. Click the drug link and you are taken directly to the adult dosing section of the montelukast Quick Answers drug information, where you can verify the prescribed dosage. Next, orders are received for IV Levaquin 750 milligrams daily for a 72-year-old male patient who is 5 feet 6 inches and 70 kilograms, who was diagnosed with community-acquired pneumonia, which lab cultures show was caused by non-multi-drug resistant Streptococcus pneumonia that is sensitive to levofloxacin. Lab values for this patient show his creatinine value is 2.2. Before checking anything else, you need to find this patient's creatinine clearance. You note that the estimated creatinine clearance based on serum creatinine is 30.1 milliliters per minute. Armed with this information, you now look up Levaquin for dosing recommendations. The adult dosing for levofloxacin for community-acquired pneumonia is displayed. You need more information to decide which dose regimen is appropriate. You click on See In-Depth Answers for detailed results. To go to the detailed drug information on the In-Depth Answers tab. You find that neither regimen is preferred over the other for community-acquired pneumonia due to non-multi-drug resistant Streptococcus pneumonia. So you go with the ordered 750 milligram regimen. However, you want to check the dosing adjustments for patient with renal impairment and with the creatinine clearance that was calculated. After reading the information and checking the reference, you feel confident that the adjusted administration order of 750 milligrams IV every 48 hours for 5 days is optimal for this patient.
Another reference you have access to is facts and comparisons. You will need to use the username and sign-on that was provided to you by the School of Pharmacy. Facts and comparisons and LexiComp are only available to School of Pharmacy students. In Facts and Comparisons, you will find a wide variety of information, including black box warnings, calculations, drug comparison tool, don't crush chew list, drug interactions, a drug interaction tool that looks at drug interactions, drug allergy interactions, and drug disease interactions, a drug pronunciation tool, drug reports by adverse event, indication and contraindications, herbal interactions, investigational drugs, look-alike, sound-alike drugs, manufacturer index, OTC drug therapy, laboratory values, off-label drug facts, orphan drugs, patient assistance programs, patient handouts, pregnancy and lactation warnings, including Briggs information, review of natural products, and therapeutic categories. The home page of Facts and Comparisons, you will see a search bar. You can also choose interactions, drug identification, calculations, product availability, drug comparisons, where you can compare up to 4 drugs, Tristel's IV compatibility, drug reports, which list the drug interaction tool, drug disease interactions, drug allergy interactions, and the formulary monograph service. I just typed in propranolol and chose the adult monograph. And as you can see, Facts and Comparisons has tabs at the top. The tab that is highlighted is the monograph tab. If you wanted to know how propranolol comes, whether it comes in an oral form or an injectable form, what type of oral form, you need to choose the product list, which is the second tab. You will also see an adult patient education tab and a pediatric patient education. Along the left-hand side are the titles of the sections of the monograph. Simply click on one of those and it'll bring you right to that section of the monograph. I'd also like to point out the pronunciation. It's important that pharmacists pronounce drug names correctly. You can use the tool in Facts and Comparisons and also LexiComp in order to learn how to pronounce a drug name correctly. Another part of Facts and also LexiComp that I like is that it uses Briggs pregnancy summaries. Briggs is considered a gold standard with regards to pregnancy and lactation data. You simply go to the pregnancy section in the left-hand side of the monograph and choose Briggs Pregnancy Summary. Whenever there is a highlighted section, such as there is here under Briggs Pregnancy Summary, there is a hyperlink to the pregnancy summary from Briggs Drugs in Pregnancy and Lactation. Click on the hyperlink and you will get more information. This slide shows you the summary from the Briggs Drugs in Pregnancy and Lactation. As you can see, it will provide you with recommendations for pregnancy and also for breastfeeding. It also provides you a summary that is based on the literature and it will give you the references.
The welcome screen provides immediate access to our clinical content by using the search box located in the center of the screen. In addition to our searchable drug information databases, Facts and Comparisons eAnswers includes clinical tools that can be accessed from the blue toolbar located across the top of the screen. The welcome screen also contains a reference list containing useful links and charts for quick access. To quickly locate drug information, enter a drug name or NDC in the search box. When entering the drug name, after at least 4 characters, a list of suggested terms will appear to assist with searching. Click the search button, or press the Enter key on your keyboard to begin the search. If the search term used is mapped to a monograph, pressing Enter will take you directly to the selected monograph. Within a monograph, there are several ways to navigate the extensive drug reference content. The left side of the screen presents a navigation tree with a listing of the available sections. Clicking on a topic will take you directly to that section. The Jump To section menu in the top right corner of the screen presents an alphabetical list of the same monograph sections and can also be used to navigate to specific information. Lastly, using the browser scroll feature will also allow you to view all of the information contained within the monograph. Additional information specific to the topic you are viewing can be accessed by using the tab across the top of the monograph. The first tab, labeled Product List, will display a list of the various products available for that drug, including route of administration, strength, and manufacturer information. Click on the See More tab to locate the product NDC, images, and other information about the product. You can click on the specific NDC to expand the image and see additional details about the selected item. The tab labeled Patient Education will display adult and pediatric patient education handouts. Throughout the monograph, specific fields of information contain links to additional information. For example, links to more in-depth Briggs's information on pregnancy and lactation, seen here. You can always click on any button in the blue bar to access another tool. Use the search box at the top left to begin another search, or click the Home button to return to the home screen.
LexiComp was acquired by Wohlers Clores a couple years ago, and they're the company that owned Facts and Comparisons, and that's why these two databases look very similar. LexiComp, however, contains some additional information that you cannot find in Facts and Comparisons. It specifically contains information on Lexi drugs, pediatric and neonatal Lexi drugs, and geriatric Lexi drugs. You also have access to AHFS, the American Hospital Formulary Service, Essentials, which is an abbreviated one, and then also the drug information. You have access to Lexi Drugs International, National Products Database, Pharmacogenomics, patient information, drug allergy and idiosyncratic reactions, pregnancy and lactation, again from Briggs, and other links to Canadian resources, drug shortages, and the Institute for Safe Medication Practices. From the home page, I typed in propranolol, and this is what comes up. As you can see, propranolol is listed in several of the resources in LexiComp. You have Lexi Drugs, Pediatric and Neonatal Lexi Drugs, AHFS Essentials, AHFS Drug Information, Geriatric Lexi Drugs, Pharmacogenomics, Lab, Test, and Diagnostic Procedures, Patient Education Adult, Patient Education Pediatric, Lexi Tox, Drug Allergy and Idiosyncratic Reactions, Pregnancy and Lactation, Vaccine Comparisons Off-Labeled, and Briggs, Drugs in Pregnancy and Lactation. If I just choose Lexi Drugs, I come up with a monograph for propranolol. And as you note again, the tabs at the top. The first tab is the monograph, the second tab is images, so you will see an actual picture of what propranolol looks like in the oral forms. Adult Patient Education is the third tab, and then Pediatric Patient Education is the fourth tab. You will also have a index on the left-hand side. Just click on what you need to find in the monograph. You will see that there are hyperlinks throughout this monograph. If you need more information, click on the hyperlink. You will also notice that LexiComp also has the pronunciation feature.
The welcome screen provides immediate access to clinical content by using the search box located in the center of the screen, or by browsing our content using the Explore by General Categories feature. In addition to our clinical databases, LexiComp Online includes clinical tools that can be accessed within the blue toolbar located at the top of the screen. The welcome screen also contains a list of newly FDA-approved medications, as well as medications that have a recent special alert. For more information, you can quickly link to the Lexi Drugs monograph. To locate clinical information, enter a keyword such as a drug, disease, or lab test in the search box. After entering at least 4 characters, a list of suggested terms will appear to assist with searching. Click the search button or press the enter key on your keyboard to search all available databases. The results screen displays all databases that include a topic matching your search criteria. To review information about a drug, click on its link listed below the database name. Additionally, if you hover your cursor over the drug's link, a listing of all available monograph sections will be displayed so you can quickly navigate to a specific section. Within a monograph, there are several ways to navigate the content. The left side of the screen presents a table of contents listing of the available sections. Clicking on a topic will take you directly to that section. The Jump to section menu in the top right corner of the screen presents an alphabetical list of these same monograph sections and can also be used to navigate to specific information. Lastly, using the browser scroll feature will also allow you to view all the information contained within the monograph. Additional information specific to the topic you are viewing can be accessed by using the tabs across the top of the monograph. The first tab, labeled Images, will display a list of all solid oral dosage forms, including images and manufacturer information. The tab labeled Patient Education will display adult and pediatric patient education handouts respectively. Throughout the monograph, specific fields of information contain links to additional information, such as in the Clinical Practice Guidelines field seen here. Finding information in LexiComp Online can be accomplished through searching or browsing within the different categories of clinical content. Although it is most common to use the search functionality, at times it is helpful to browse the available content by category. The Explore by General Category section provides this browsing method. For example, the Explore by General category can be used to access the oral medications that should not be crushed chart. This information is from our Charts Special Topics section of the database. The same search method can be used to access a number of different indexes, such as an alphabetical list of topics, recently updated monographs, or drugs that have REMS.
AHFS, or American Hospital Formulary Service, is located in StatRef, which you can find on the homepage of the library and also in LexiComp. And the monographs for AHFS are organized by the pharmacologic therapeutic classification that is specific to AHFS. Monographs in AHFS contain title and synonyms, REMS, introductory description, uses, dosage and administration, cautions, drug interactions, laboratory tests, acute toxicity, chronic toxicity, pharmacology, mechanism of action, pharmacokinetics, and chemistry and stability. Here's an example of the propranolol monograph for AHFS drug information. And again, I suggest that you use the drug information part of the AHFS and not the abbreviated part. And here you can see right off the bat that it's organized a little different than Lexicomp and Facts and Comparisons. You can see it's organized in paragraph form. You will find much more detailed information in AHFS. Again, if there is a hyperlink, click on that hyperlink to get more information. The next set of references I'd like to review are located at the home page of the library website. And you can see here the top part of the biomedical biosciences is where you're going to find PubMed, Cochrane Database, Embase, Google Scholar, and these are all secondary sources. But I would like to talk to you about the clinical point of care tools that you may be using in this class to answer drug information questions. And the ones I will go over include Clinical Key, Dynamed, and UpToDate. UpToDate is one of those resources that you will find yourself using quite a bit. UpToDate provides evidence-based summaries of clinical topics. It is written by experts around the country. You will find quick access to synthesized information. And the drug information in UpToDate is provided via Lexicomp. This is an example of UpToDate. I simply typed in migraine in the search field, and you will see that I have several topics. And the first topic there is acute treatment of migraine in adults. Once I choose that topic, acute treatment of migraines in adults, I get the monograph containing this information. You will see again to the left the topic outline. You can click on any of the subtopics within that outline and the monograph will come to that part. You can also see that there are hyperlinks within the monograph itself. Click on those to find more information. If you wish to print the UpToDate monograph, you can hit the print button located in the upper right hand corner and you will get the entire monograph ready to be printed out. Dynamed is another database that is organized by disease state and provides evidence-based summaries. The drug information in Dynamed is provided by AHFS Essentials. In Dynamed, for each disease, you will find related summaries, general information, causes and risk factors, complications and associated conditions, history and physical, diagnosis, treatment, prognosis, prevention and screening, guidelines and resources, patient information, ICD-9, ICD-10 codes, and references. I particularly like Dynamed to determine more recent guidelines and review articles on that disease state that I am searching for. In Dynamed, in the search field, I search for migraine. As you can see, I get an array of topics up. The first one is migraine in adults, and then after that, I get other topics up regarding migraines. I just chose the first topic, migraines in adults, and you will see again on the left, I have a topic menu for the monograph itself. Each monograph here has the same headers that are located on the left. Again, I like to use this site for guidelines and review articles. It provides you very brief, insightful information on the disease. So here is an example of the treatment for migraines in adults. As you can see, I get bulleted information and then I have basic results and they give a grading criteria, level 1, level 2, level 3. You can click the hyperlink to see how that is defined. If you compare this to UpToDate, UpToDate is written in paragraphs and they're both very useful databases. I find myself going to both UpToDate and Dynamed. Again, for Dynamed, this is one of the sources I go to first when I need to find a guideline. I go under guidelines and you will see Dynamed has international guidelines, United States guidelines. They also have European guidelines and other country guidelines if they are listed. You can click on the hyperlink and you'll get the article, and sometimes there's even a PDF that you can click on and you'll get the full text article. Clinical Key is another great resource. It is a collection of medical texts, journals, review articles, drug information, guidelines, and images. Again, it has quite a few books in it. The books I find myself using are Kahn's Current Therapy, Ferry's Clinical Advisor, the Harriet Lane Handbook, Goldman's Cecil Medicines. I also find myself going to Myler's Side Effect of Drugs. I know that Clinical Key has this book, so I will often go into there if I need to find a mechanism behind an adverse event. Clinical Key will also have journals that are not in Medline, like the Clinics series. And the drug information in Clinical Key is supplied by Gold Standard, which some of you may be familiar with. This source is found in Clinical Pharmacology. So here's the homepage of Clinical Key, and you can search for conditions, procedures, drugs, and more. All you need to do is go down there under Browse if you want to search the books, the journals, the drug monographs, guidelines, patient education, multimedia, or procedures consult. You can also just type in your keyword in the search field, and it will search all of these for you. So this is an example of the guidelines. So I just chose to browse by guidelines, and you can see this source has numerous amount of guidelines, and it will bring you to the full text of these guidelines. Here I went under the books, browse books, and I know that Myler's Side Effect of Drugs is in here, so I just search for effects, and I get the book titles that contain the word effects. And you can see the second choice there is Myler's Side Effect of Drugs. This is an example of Myler's Side Effect of Drugs, the 16th edition, copyright 2016. Excellent source. I especially like to go here when I need to look for a mechanism of an adverse event. So once I find the drug I need to look, like in this example, I just chose olamizumab. You'll see that there's a little PDF icon. In order for you to download the PDF in any of the documents in Clinical Key, you need to create a free account. So just go under Register, which is located in the upper right-hand corner, to create an account. Once you have created an account, and again, this is free, you will be able to download the PDF copies of the articles or any document in which you would like in Clinical Key. This is an example of the Clinical Key again in the multimedia section. You can see that there is various figures and animations available to you. So if you ever need a figure and animation, I would certainly consider going to Clinical Key and browsing multimedia. This is an example of the clinics. As I said, clinics is not contained in Medline. I know the clinics are here in Clinical Key. So if I'm looking for an article that shows up in clinics, I know I can find it in Clinical Key. And then the other way around is if I'm searching for something in Medline and I don't find what I would like, or I want to double check and make sure there's no other information, I can go to Clinical Key and search, and I know that I will get articles that are published in the Clinics series. Access Pharmacy is another database that's located on the library homepage under the Pharmacy Resources. It contains many pharmacy-related texts such as Applied Pharmaceutics and Pharmacokinetics, Applied Clinical Pharmacokinetics, Cassett and Dole's Essentials of Toxicology, Goodman and Gilman's The Pharmacologic Basis of Therapeutics, Harrison's Principles of Internal Medicine, and Pharmacotherapy by PDRO. This is the homepage of Access Pharmacy. As you can see, you can search in the search field for any topic you would like. You can also click on a book and search within that book. One of the other tools I always like to tell students about in Access Pharmacy is our study tools. If you go and create an account, again, it is free. You can create your own little quizzes and that go specific to the textbooks. They have reviews on this site also if you needed any of that information. I know we went over a lot of information today. If you do have any questions, email me please. My email again was given at the beginning of this presentation, but it's also in the Canvas course. So I do look forward to working with you this semester, and please don't hesitate to email me with any questions.